Hello, I'm Hannah Donnett with the Collaborative on Health and the Environment. Che enjoys bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to Che's partnership webinar titled Disinfecting, Cleaning, and Best Practices for Protecting Your Family During the COVID-19 Pandemic. Our moderator today is Karen Wang, Director of Che and founder of Because Health. We will leave time following the presentation for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the presentation. After the presentation, our moderator will read out questions for our speaker to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our speakers. This webinar is scheduled to last for 45 minutes and is being recorded for our call and webinar archive. With that, I'd like to introduce our speakers. Our first speaker is Dr. Stephanie Holm, co-director of Western State Pediatric Environmental Health Specialty Unit, PEHSU, at the University of California, San Francisco. Dr. Holm received her medical degree from the University of Pittsburgh and is board certified in both pediatrics and occupational and environmental medicine. She also has an MPH in epidemiology at UC Berkeley and is currently working on her PhD in epidemiology. Dr. Karen Wang is Che's director and is founder of Because Health, an environmental health education campaign for millennials. Karen has a PhD in management and organization, a combination of applied economics and social psychology from the University of Washington, and a Master's of Science in Environmental Science from Stanford University. With that, I'd like to pass it on to our first speaker, Dr. Holm, if you'd like to start.
Anyways, thank you for the warm welcome, Hannah. I want to start first by just acknowledging some colleagues who've worked on this topic with me. If you move to my next slide, Hannah, it's some of my Region 9 PEHSU colleagues. And I'll note that my work at the PEHSU is partially funded by the EPA and ATSDR, but that my presentation, of course, represents my own work, and I do not speak on behalf of those agencies. All right, next slide. So I'm effectively going to start by actually giving away the punchline of this presentation. And the reason that I'm going to do that is that if you remember nothing else about what I say, I want you to know that this resource on the next slide that Hannah is going to show you, know that this resource exists. It is on our Western States PEHSU webpage. I gave you the hyperlink at the bottom, back one, Hannah. Or you can go to wspehsu.ucsf.edu, and it's under the fact sheets tab. We've also tweeted the infographic resource on our WSPEHSU Twitter account, so it's there as well. Yeah, perfect. Thanks, Hannah. We'll come back to this at the end of the presentation, but I wanted you to just have seen it, know that this resource exists, know that you can access it, and then after we cover some of the science behind it, we'll wrap up by going over all of the recommendations in this infographic. All right, next slide. So why worry about disinfectants? Well, in the short term, many of you may have heard, but the CDC Morbidity and Mortality Weekly Report a few weeks ago had some data from the National Poison Center Network showing that there's actually been quite a large increase in poison center calls related to the use of disinfectants and the use of cleaning products in the last couple of months. There was a huge increase really right at the start of March, right as the COVID pandemic ramped up compared to prior years. So you can see in the black line, we've got the number of reported exposures, that's the number of calls to the poison control system nationwide for 2020. And then in the blue, you have 2019, and in the gray, 2018. And you can see that for both cleaning products and disinfectants, the black line, that's this year's data, really jumps up pretty substantially at the start of March. It's worth noting that poison center calls generally happen either if an exposure causes immediate symptoms, right, like someone acutely has difficulty breathing, or if there's an ingestion, right? So either that's a toddler inadvertently getting their hands on a container that was left out or left too low where they were able to access it, or somehow a product was consumed because, you know, families, when they're running low, have shared products with other people and the disinfectant gets stored in the wrong container and someone doesn't know that that's what that product is and it gets consumed. So those are sort of the two most common big reasons that poison centers get called. What these data don't capture is long-term effects from disinfectants. This is really just specifically looking at short-term. Next slide, Hannah. So unfortunately, data don't really exist regarding long-term effects of multiple exposures to single chemicals. And that's because we're all sort of exposed to a variety of chemicals all the time. But what we can do is look at the data from those who do cleaning work, right? People who are employed doing cleaning. So we know that they've been exposed to cleaning chemicals chronically. Those who do cleaning work as part of their jobs have the highest rates of work-related asthma. And that's particularly true for people who have to mix disinfectants as part of their job. That's both, like people doing household or commercial cleaning, and also people who do cleaning as part of another job. So for example, nurses end up doing a lot of cleaning work in hospitals. That includes all of those sorts of folks. In a household setting, people who clean their own home have higher rates of respiratory symptoms. So that's things like asthma, shortness of breath, if they report that they use bleach or if they use multiple different kinds of cleaning sprays. Specifically thinking about kids, so there's something called volatile organic compounds, often abbreviated VOCs. Those are these chemicals that can be in the air that are commonly released by a number of different things. Lots of scented products release these, and lots of cleaning and disinfecting products can release VOCs. Children whose homes have higher levels of these VOCs are more likely to have asthma. It's also been shown that kids whose homes have more cleaning sprays used are more likely to have inflammation or irritation in their airways as they get older. And a recent study out of Canada, a big cohort study, showed that kids whose parents reported more exposure when the kids were babies, that they were more exposed to cleaning products, those kids were more likely to wheeze when they got older. Hannah, my internet just dropped. I'm still on the phone. Can you continue to hear me?
Yes, I can hear you.
Excellent. I will keep going then.
To the next slide.
Yep, next slide. Thank you so much. So in terms of thinking about real world use, there are some issues of real world use that come into play when we think about disinfectants. I like to joke that sometimes folks think that disinfectants have almost magical qualities, right? That if the disinfectant is sort of anywhere near a surface, that you get it disinfected immediately and forever. And obviously that's not true. But I think there are some sort of basic pieces to cover that'll help, help us think more critically about that common misconception. So the first is that a lot of people don't understand the difference between cleaning, sanitizing, and disinfecting. So what do I mean by that? Cleaning is the removal of soil and any organisms, right? So that's like dead skin cells, anything that you can see, right, is soil on a surface, things that need to be cleaned. That's done by scrubbing with a clean cloth. And by doing that, you actually get rid of most of the organisms on a surface. If you clean with something like just a basic soap or detergent, you're gonna either mechanically remove, like literally wipe off, or break up the cellular material for most of the organisms on a surface. Sanitizing and disinfecting are specifically intended to kill organisms that are present with different thresholds for how many of them have to be killed. Sanitizing kills fewer than disinfecting. But as I said, cleaning alone, if you do it well, will actually remove or inactivate most of the organisms from a surface. And frankly, in order to be sanitized or disinfected, you need to clean first. And the reason for that is that a lot of organic material, so anything that comes from humans or from animals, can deactivate many disinfectants. There are some products that are sold as one step, so they can clean and disinfect. But even those ones won't be able to disinfect properly if you have what's called a biofilm present. Biofilm is that sort of like sticky, wet gunk. You can think about like if you leave your shower too long, kind of at the corners where things stay a little bit wet, you can get that kind of grimy, sticky kind of stuff. In the presence of a biofilm like that, even those one-step cleaning, disinfecting products aren't able to adequately disinfect. So I think the best way to think about it is that you should always be performing a cleaning step first before trying to disinfect. And then another issue that many people don't realize is that disinfectants all have a specific dwell time. This is sort of, getting to my joke about it not being magic. these are chemicals, right? And so you have to think about it in terms of it being a chemical process. If you were, you know, taking chemistry as a middle school or high school student way back when, you had specific instructions you had to follow and specific amount of times where you had to wait for the different steps. This is the same idea. Each disinfectant has a specific dwell time. That's the time that it needs to remain wet on a surface in order to disinfect. So for example, most plain household bleach, that dwell time is 10 minutes. That means that you need to literally put bleach on the surface and leave it sparkling wet for 10 minutes in order for it to adequately disinfect. I think so many people don't realize this, that they end up not using the disinfectant in a way that's going to truly provide disinfection, but that still exposes them to these chemicals. And so that's a problem. The way to know what that dwell time is to just read the bottle. All disinfectants have to have this material on either on the bottle or in their product instructions. And so you should be able to find that out. And just know that that's an important thing to pay attention to. One other thing to just mention, pardon me, is that all EPA registered disinfectants are actually only registered for use on non-porous surfaces. So bathroom counters, stainless steel, that sort of thing. They are not actually certified for disinfecting on porous things, things that can soak up material like untreated wood or fabric or cardboard. All right, so having established that disinfectant use is common, and Hannah, you can move on to the next slide, but not particularly well understood, let's talk about the toxicities of two of the most common disinfectant classes, two of the things that you have certainly seen at some point in your life, maybe even have in a cupboard right now. Slide. So we'll start with bleach, because that's the most commonly used disinfectant in general, and also has specifically been noted to be a cause of many of the increased poison center calls recently. Bleach is thought to kill things by clumping together the proteins within a microorganism. And as I mentioned a minute ago, the dwell time for most bleach products is usually 10 minutes, although it can vary somewhat. Some products have dwell times as short as 5. A lot of people are aware that if you're exposed to large amounts of bleach, it can make you cough and have difficulty breathing. But I think it's also really important to remember, because this is a chemical, that when it's mixed with other things, it can create some particularly toxic gases. So for example, bleach and ammonia mixed together create a toxic gas called chloramine. Bleach mixed with any kind of acid, including acids that people think of as being, you know, just normal household things like vinegar, bleach and vinegar together can create chlorine gas. Chlorine gas, if you don't remember, was a gas that was actually used as a chemical weapon in World War I. So this is a really bad thing that you can inadvertently produce in your home by mixing chemicals. You should be really careful to never mix cleaners or disinfectants. As I mentioned, there can also be long-term health effects. Bleach specifically has been associated with asthma in both animal studies and in people doing cleaning work. It's what's called a designated asthmagen, meaning that there's a group that's determined that there's enough evidence that bleach actually causes the development of asthma to list it as a chemical that does that. And as I noted, it's been responsible for a large increase in the poison center calls recently. Next slide. The other big class to think about is what are called quaternary ammonium compounds. These are also a really common class. You'll probably recognize these if you read the bottle because they'll have a long chemical name with multiple numbers that has ammonia somewhere in it. So there's lots of these sort of like 2, 3 ammonium, such and such and such. Up until a couple of years ago, when companies began branching out at least a little bit more, most of the disinfectant white products that you'd seen, you think of some common brand names in your head right now of disinfectant white products, those common ones are probably quaternary ammonia compounds. These are cationic detergents. They're thought to act in a couple of different ways. They disrupt the membrane, so the sort of outer layer of a microorganism, and also maybe work on the inside too. These were started to become popular as a, quote, alternative to bleach, although I would argue that they should not be used as an alternative to bleach. They often have slightly shorter dwell times than bleach, often in the range of 4 or 5 minutes, although they can be as long as 10 as well. These release ammonia during cleaning, and particularly if you're cleaning small spaces without good ventilation, the levels of ammonia in the air can get quite high. So there was a study of cleaning workers cleaning small unventilated bathrooms, which showed that they are exposed to really high levels of ammonia just by using these products. Quaternary ammonia compounds are also known asthmagens. Again, that means that exposure to these can cause the development of asthma. And these actually have what's called a higher odds ratio than for bleach, meaning that exposure to the same amount of bleach as a quaternary ammonia compound, the quaternary ammonia compounds are even more likely to cause asthma than the bleach. There's also been a couple of studies that have suggested in animals that these compounds can affect the DNA and could have even reproductive effects. I will say there's not any evidence of that in humans so far, but it hasn't been well studied. And I certainly think it's enough to be concerned, to worry about their use around pregnant people and worry about their use in young children. Again, important not to mix disinfectants. All right, slide, Hannah. So we've discussed that there's major health concerns with two of the most common categories of disinfectant. What kind of tools are available to you now if you want to use safer options? Slide. So in terms of cleaning, my best simple advice actually is to just clean with a basic unscented soap or unscented dish soap and water. You want to use a new cloth or sponge frequently. Wash them after every time you use them. If you can get one, microfiber cloths do the best job of not transferring microorganisms from one surface to another. They're sort of more sticky, so they trap things on the cloth rather than moving it from surface to surface. If you want a commercial cleaning product rather than just a soap, there are a couple options of ways to tell which products are safer. On the left is the Green Seal logo. This is a group that has really strict standards for certifying products as safer. Many of the products that they've certified are commercial products. So particularly if you're looking at purchasing products for, a daycare or something like that, I'd certainly look and see what you can do in terms of finding Green Seal products. The EPA also has a Safer Choice label. It doesn't have quite as strict the guidelines as Green Seal, but the intent is still that these are products that are safer for human health and the environment compared to sort of the whole range of disinfectants and cleaners that are out there. Sorry, specifically cleaners. Safer Choice doesn't do disinfectants. Products that meet the Safer Choice standard will have this label affixed to it, which, as I said, means that they're safe for both human health and the environment. Sometimes these can be difficult to find, although I was pleasantly surprised that last night at the grocery store, I was able to find one on an otherwise somewhat empty disinfectant shelf. So maybe you'll get lucky as well. Next slide, Hannah. So then what about specifically for disinfectants? So under the umbrella of the EPA Safer Choice program is actually this Design for the Environment Antimicrobial Pesticide Project. So this is the arm that reviews disinfectants, and they still use this older, what they call the Design for the Environment logo. I think that's a little bit confusing sounding because it makes it sound like this is really just an ecological thing. But as I said, these are products that they've reviewed to be safer for both the environment and human health. On this list, they have a list of active ingredients which are safer. Currently, that's these 7 active ingredients. That's citric acid, hydrogen peroxide, L-lactic acid, ethanol, isopropanol, peroxyacetic acid, and sodium bisulfate. They have a list of specific criteria that you can look at if you're interested, but basically, again, it's in order to meet these criteria, these active ingredients have to have very minimal health effects. In addition, they certify specific products. So in order for a specific product to end up on this list, it has to not only contain one of these active ingredients, but they have to have submitted their entire list of inactive ingredients to the EPA for review as well. And the DFE program will go over the entire list of active and inactive ingredients. So in general, if you want to find a safer product for disinfecting, an easy first step would be to find one with one of these active ingredients. The safest thing to do would be to find one that's specifically on the Design for the Environment list, because that'll tell you that not only the active, but also the inactive ingredients have been reviewed. All right, but what about this pandemic specifically, right? Some of you may already know that EPA has a program for releasing lists of products, next slide, Hannah, that they expect to be effective against new pathogens. So they used this program to create a list for the COVID pandemic of products that they expect will disinfect the coronavirus that causes COVID, because they're known to disinfect similar organisms. I'll note that that doesn't actually mean that these have been tested against this coronavirus, but that they've been tested against indicator organisms that are similar, against things that the EPA expects if these products kill these other organisms, it means that we'll also disinfect against the coronavirus that causes the current pandemic. So what can you do with this list? So the N list are the products that we expect to be active against coronavirus. What I'd recommend that you do is actually, you want to compare these two lists. So on the right, I'm showing you that same list of active ingredients that I pulled off the DFE list. And on the left, this is what the N list has looked like for a while. You can look in the active ingredients column for products that contain one of these active ingredients. They actually just a couple of days ago rolled out a new N list tool. So if any of you have looked at it, there's actually a nicer option now where you can click for it to filter by active ingredient. So you could say, I want to look at just the hydrogen peroxide products, or I want to look at just the isopropanol products, and it'll show you those. Again, if you're able to look at that and then look at the list of products that are specifically on the DFE list to get the safest options. All right, so to wrap up, let's go back to the infographic now that we've sort of talked through some of the science behind why we should be worried about disinfectants and how we could pick a safer disinfectant for this current pandemic. So the first thing that we tried to set up with this infographic is just the idea that disinfectants can have health risks, right? That unlike people think that sometimes people will say that if a little disinfectant is good, then lots must be better, and that's not true. You want to use just the appropriate amount to achieve the task that you're intending to achieve and minimize the side effects. So if no one is sick at your home, we recommend cleaning surfaces with an all-purpose cleaner or soap and a clean cloth, microfiber if you can get it. That's going to get rid of most of the germs on a surface and avoids giving you extra exposure to disinfectants. If you're leaving the home to go either to work or to go grocery shopping, any surfaces that you touch when you come back in before you wash your hands should be disinfected. You want to clean them first, as I said, and then disinfect them. So for example, in my house, we have a doorknob that gets touched when we come back in, and we have sort of a shoe rack right near the front door where we take off shoes, and that gets touched with unwashed hands. Those are the areas that I focus disinfection on. The rest of my house just gets clean. Because currently, knock on wood, no one's sick here. If someone in your house is sick or you think they might be sick, then what you want to do is, again, clean everywhere, but you want to disinfect the high-touch surfaces. The way to do that is by picking a product that's on both EPA lists. That's the Design for the Environment Antimicrobial Pesticide list. Those are the safer ones. And the N list. Those are the ones that have been shown to be effective against the coronavirus. We've listed the products there for you that, or sorry, the active ingredients there that occur on the DFE list in case you want to have them handy. And you want to remember to always apply a disinfectant to the surface and leave it glistening wet for the time that's listed on the product label. You don't want to expose yourself to a disinfectant without getting the benefit of the disinfectant. And then because we're living in the real world and there are supply chain problems and shortages, we wanted to mention what you should do if you can't access safer products. So if you don't have access to microfiber, sponges, towels, of course, work as well. You just want to make sure that you're washing them frequently and changing your towel or sponge frequently as well, so that you're not transferring microorganisms from one surface to another. You can clean sponges by washing them in the dishwasher. You can soak them in a diluted formula of bleach. You can microwave them if they're non-metallic. You don't want to microwave sponges that have the the steel wool attached to them. But if they're non-metallic, you can also microwave them for a minute to kill organisms on them. For towels, you can wash them in a basin or a washing machine, as you probably do already. And then if you only have access to a disinfectant that I mentioned has health effects, you can use it by ensuring that you have the best ventilation possible while using it. You want to be really careful not to combine products, and you want to be sure that you're following the package instructions both for dilution and for dwell times. I would also say you want to, if you're having to use those products, try and do it in a way that minimizes exposure to vulnerable individuals. So if someone in your family has asthma and someone else doesn't, it would be good to have the person without asthma be the one that's using this product to clean surfaces. Disinfect surfaces. If you have young children in the house, I'd try and have them away from the area where you're using disinfectants, those sorts of things. All right, that's sort of, as I said, a background on the science and then a tour of the infographic resource. This is on our webpage. We also have a longer 2-page fact sheet that's there as well if you want more information. This is also there in Spanish as well if that's helpful for folks. And I think I'm turning it over to Karen, who has a few other things to add.
Great.
Oh, sorry.
Thank you so much. Yeah, thank you so much, Dr. Holm, for your presentation, for all the information you provided us. While Karen is pulling up her slides, I'd like to encourage you guys, everyone, to put your questions into the Q&A feature, and we'll get to those at the end of the webinar, as many of them as we can. We've already got quite a number of them. Great. Karen, you want to take it away?
Yes. Am I sharing?
We don't see your screen. Do you want me to pull it up?
No, I got it. Let's see. Is it on now? Yes.
Yes.
Okay, great. Thanks everyone for joining today. I'm gonna add on to what Stephanie presented. And I just want to note, because I know many people will be watching this in the future, that everything that we are talking about today is to our knowledge and of the science that we know of today. But because this is such a new and evolving pandemic and virus, you know, if anything changes, please refer to CDC, EPA, state, local public health guidance. And another note that, you know, this talk is mainly geared towards the general public. If there are populations, if you are cleaning or are immune compromised, are older, have pre-existing conditions, you might want to just take that into account based on your own health and your health professional's guidance. So I'm going to talk a little bit about how stable the new coronavirus is on surfaces. So there have been 2 studies that have looked at it that have just come out last month. And basically, the more smooth a surface is, the longer the virus will persist. And these are times for at room temperature, about 72 degrees at like a normal humidity level. So you'll see here that on plastic and stainless steel, it can survive up to a week. But on things like, you know, tissue paper and paper, only a couple of hours. And there's a couple of other things that affect the stability as well. One of the studies also looked at sensitivity to heat. So when it's dropping down to freezing, the virus can stay active for much longer, up to 2 weeks, even more than 2 weeks. And then as soon as things heat up, that it is very short-lived. The virus is also sensitive to relative humidity. So the more humid, the more likely it is to be deactivated. And is also sensitive to ultraviolet light. So if it's in sunshine, that it would be deactivated quicker. There's 3 important things that we would like you to remember. The first is that soap is very effective at helping to remove and deactivate the virus. Stephanie talked about this. You'll see in these graphics why. I'll just quickly go over this, even though you can read a lot more about it online. But the new coronavirus is an enveloped virus, meaning that it has a protective outer layer of lipids, so it's basically fat. So if you think about how soap can help get grease off your hands or off of a stove, it's kind of the same way. Soap will disturb sort of this fatty outer layer, and once it does that, then all the genetic material gets into the water and then it washes away. So soap is very effective. And for this reason, we always recommend hand washing, and that's why hand washing is so effective. Even with just a normal soap, you do not need an antimicrobial, antibacterial soap, just normal soap. And that's also why, Stephanie mentioned several times that cleaning a surface just with an all-purpose cleaner with just a soapy water will help. And we'll get back to that when we talk about some of the the questions that people have. So just another couple notes about using disinfectants properly. As Stephanie said, look for products on this EPA list N. You know, that is always preferable to find something that's been registered with them. Pay attention to contact time or dwell time. The surface should be visibly wet. And you know, some of these products have very long dwell times, 5–10 minutes. So please pay attention to that. Again, never mix products and follow instructions. Sometimes they'll say wear gloves, other things like that. So please pay attention to that. And of course, ventilate, open windows, doors, fans whenever you're disinfecting. Here are some examples of products, safer products on the EPA list N. So these are products that have the active ingredients that are on the EPA Design for Environment list that Stephanie went over. And you'll see that, you know, some of these products have brand names that you recognize. Some of them are sold, you'll see, for commercial or healthcare situations. But all of these are, you know, safe to use at home as long as you follow instructions and ventilate as well. So here's a, and, you know, this is not an exhaustive list. I just picked some that had brand names that were more recognizable. So what surfaces should you be disinfecting? Hannah talked about, or not Hannah, Stephanie talked about disinfecting the doorknob when you first come in. You know, so should you be disinfecting the walls and windows in your home? The short answer is probably not. Here are some examples of things that are frequently touched in your home by, you know, multiple people or by hands when you go out and come back. And now that many people are leaving their homes again, I think that it's much more important to think about disinfecting in these high touch areas. So door handles and knobs, locks, light switches, tables and counters, cabinet and appliance handles, toilet flushers, faucets, cell phones, laptops and keyboards, mouses, remote controls, and garage door openers. So it's not an exhaustive list, but it's just a list of things that you might be touching. Many people have asked us about DIY disinfectants because they are not able to find commercial products. So I will say that, you know, it's preferable to buy a commercial product that is on the EPA list N, but if you cannot, there are a couple things that you can do. First is an alcohol solution with at least 70% alcohol, contact time for at least 1 minute. Is one disinfectant that you can use. A second is hydrogen peroxide. Should be 3%, and that's usually what you would find at a pharmacy. And just a note that if you are going to be using hydrogen peroxide as a DIY disinfectant, it gets deactivated when it is exposed to sunlight. So please keep it, and that's why it always comes in those dark brown bottles. So keep it in a dark bottle or put it into, you know, another clear bottle and only use the amount that you'll be using that day. The dwell time is from about 3 to 5 minutes. There's not specific research showing that that's the dwell time, but a 3% hydrogen peroxide solution will take out other viruses that are tougher to kill than this new coronavirus. So let's see, you can also use bleach. This is what's recommended on the CDC website for the solution. But, you know, as we talked about, there are some health effects with a bleach solution. Once again, we'll just say never mix ingredients. This especially comes down when you're mixing things or doing a DIY disinfectant. Even things like hydrogen peroxide in vinegar, for instance, which are two very common DIY disinfectants, when they are mixed together can be dangerous. Be mindful of storage and expiration dates. So for example, bleach can actually become deactivated quite quickly after the expiration date. So you want to check that. And if you are using a bleach solution, the solution only really lasts for 24 hours. So you really only should be mixing what you need for that day. Just a side kind of tip, a lot of spray tops will actually fit directly onto the rubbing alcohol and hydrogen peroxide bottles that you would buy at the pharmacy. So you can just unscrew a spray top from another bottle, make sure it's very clean, doesn't have any leftover product in it, and pop it onto these bottles. Another tip that I've also found is dark colored kombucha bottles with a narrower mouth. A lot of them are also compatible with these same spray top bottles. So you can just have a kombucha, save the bottle, clean it out, and use that as a free glass bottle. So what about DIY cleaners? I'll just mention that, there are also health impacts of just cleaners, not just disinfectants. And since you should be cleaning before you disinfect, here are some all-purpose cleaners that you can make. One is just half vinegar and half water. The other is water with a couple tablespoons of liquid soap. It could be dish soap, could be a Castile soap. It's a good idea to stay away from fragrances and unnecessary chemicals. You can look for commercial products with the Safer Choice label because health also has recommendations for other all-purpose cleaners and other DIY recipes if you wanted to make a glass cleaner or something like that. What about hand sanitizers? This has also been in the media a lot. So I'll say a couple of things about hand sanitizers. Do not use surface cleaners or disinfectants on your hand or skin. So those things that we had been talking about are not appropriate for getting your hands clean. Hand washing with just plain soap and water is preferred to hand sanitizer. This is because it not only does it deactivate the virus somewhat, but it also just physically removes it from your hands, whereas hand sanitizer does not. Also, hand sanitizer doesn't work very well if your hands are dirty or greasy. So, when my 4-year-old has just eaten something greasy, or if she's outside playing with dirt or sand, a quick squeeze of hand sanitizer is actually not going to be, reducing the virus as well as hand washing. Also, hand sanitizer needs to be used properly, and many people don't rub vigorously for 30 seconds, and that is the recommendation. Same goes for hand washing. You need to be rubbing vigorously in all the nooks and crannies for 30 seconds. So that is the same, whether or not you're hand washing or using hand sanitizer. It's preferable to buy hand sanitizer if you can. We do know that many people are having to DIY now. So make sure that anything you do make has at least 60% alcohol. A simple recipe for that would be, you have to be very careful because the rubbing alcohol is pretty much never sold as it's never sold as 100% solution. So you'd have to make sure that whatever you're mixing ends up having 60%. So you have to do a little bit of math. So right here we have a recipe for 2/3 cup of 91% rubbing alcohol and a 1/3 cup of vegetable glycerin or aloe vera gel. Just a note that if you mix it too quickly, that it will clump up sometimes. So you want to think about it mixing slowly as if you're making a salad dressing. Okay, so that's about hand sanitizers. One question that we get a lot is about disinfecting groceries and other deliveries packages. So first off, I'd like to say that this may not be necessary. It's highly unlikely to be a source of transmission. That being said, many people still are choosing to be careful for different reasons. If you're immune compromised or have elderly parents, etc. So if you would like to, and one of the easiest things you can do is just to leave the packaging, just dispose of the outer packaging, or leave the box alone for a couple of days. So you'll see, if you remember from the first slide, that on cardboard, on paper, the virus doesn't survive for too long. And you can also, for groceries, for let's say you bought a jar of mayonnaise, well, you could just leave that and not touch it for a couple of days. If it's produce or things that need to be refrigerated or frozen, the simplest thing is actually just to wash it with soap and water, which is a great idea anyways if you're going to be, eating an apple, for instance. So simple soap and water, as we talked about before, is very effective. And if there are some packaged foods that you really would like to disinfect, I'll say that it's very unlikely to be a source of transmission, but you could wipe it with a disinfectant wipe or spray it. Just be very cognizant of the dwell time, that it needs to be wet for a certain amount of time, and you'll want to weigh that against the risk of getting food poisoning because you left your frozen meat out for too long. So please be smart about that. Do not spray disinfectants directly on the food. Even the DIY disinfectants, it's not a good idea to spray them on things that you will be eating directly. We're really only talking about the packaging. And then of course, be smart, wash your hands after handling all packages and deliveries. Another question we get is, does laundry deactivate the virus? So yes, if you use detergent, which is like a soap, it should, do the same thing, physically remove it and deactivate some of the virus. If you want to be extra careful, use the warmest water setting in your washer and dryer. Most dryer temperatures get up to 130, 140 degrees. And at those temperatures, the virus doesn't survive for very long. Before you wash your clothes, please, if you think that clothes is contaminated, if you're coming back from work, if you're coming back from being out, don't shake your dirty clothes all around. Wash your hands after handling the potentially contaminated clothes. And the best thing to do is to get a laundry bag that you can just kind of throw in with the wash, so that gets cleaned every time. And, some people are, especially if they're working in high-risk settings, they are coming home, changing their clothes, and just washing that. It's not necessary, most likely, for the general public, but it can be a good idea not only for, this virus situation, but for in the future, sending your kids to daycare where they get a million other colds and flus every season. It can also be a good idea for that too. So another question that we are getting now that people are going out more and wearing face masks is, how do I clean my face mask? So I'll first off say that disposable masks should not be sanitized or washed. They are very fragile, and if you have a stash of disposable surgical masks, they really should only be used one time. Cloth masks, on the other hand, should be washed with soap or detergent with every use. You can either throw it in the washing machine or hand wash it with warm or hot water. Some of the masks have a filter pocket where I've seen everything from using a coffee filter to a paper towel or shop towels, anything, or sometimes people are even buying filters to go in them. Those filters really cannot be washed and should only be single use. So those need to be disposed of. You need to be very careful about washing your hands after touching the masks, just in case the mask is contaminated. One thing you could do, this is not really recommended, is to leave the mask alone for a week. Don't touch it. But remember that there are other germs that can persist for much, much longer. Another question that we've been getting is, will an air purifier help? So we'll say that there aren't any studies with this new coronavirus. It might help if someone at home is sick. You could run an air purifier in the room near the sick person. It could be a good idea. Anyways, since we are home so much now, and indoor air can be quite polluted if you turn on the stove or other things like that. You just want to make sure that you replace the filters according to the manufacturer recommendations. And as an alternative, just opening a window has also been shown to be very helpful, just increasing fresh air. What if all I have is a bleach or a quat-based disinfectant? I'll just repeat: to ventilate in any way you can, wear gloves, follow directions, note expiration dates. And after the recommended contact time, you can go back over surfaces with water. Sometimes people do that to sort of just reduce the smell. So that's one thing that you could do. And we also want to note, do not use them around children. Kind of get someone else to watch them or put them in a different room with a screen. Do not let them help or play with these products. And store them out of reach, like really out of reach, even if they were to climb onto something and get them, because of kids and what the trouble that they get into. And some other tips: when leaving the house, don't bring things or wear things that you can't wash or disinfect easily. For instance, like a leather metal belt buckle or a leather bag that could potentially get contaminated. You probably don't want to be spraying those things with a disinfectant. You can't wash them. A reusable kind of cotton tote to carry the things that you need would be great, or just your pockets. And another thing is, don't leave the top to your disinfectant wipes open. Remember that they need to stay wet on surfaces for the specified period of time. And if they dry out, then you really shouldn't be using them. Sometimes people have asked, can I just pour water in them? And the answer is probably no, because you don't know exactly how much you should be pouring in. The one last thing I forgot to mention when I looked at when we had the list of recommended products from the EPA was that the sample products are on list N, is think about the scenarios in which you'll be using them, and think about, like, is it practical to have this thing be wet for 10 minutes? And if it's not, maybe you can choose a disinfectant that has a shorter contact time. Okay, and with that, we're gonna start answering some questions. Let's see. Hannah, for some reason, here it's a Q&A. Got it. So there are a couple of questions for you, Stephanie, at the beginning. Are you concerned about how people disinfect or sanitizing in order to reduce the risk of catching this coronavirus? They might end up contributing to resistant bacteria.
That's a great question. I think in general, antibiotic use is a bigger issue related to bacterial resistance, but I think certainly misuse of disinfectants is a concern as well. And particularly if people are doing things like spraying them on, not leaving them for an adequate dwell time. So these microorganisms getting exposed to the disinfectants, but not actually killed by the disinfectants, that could potentially be a concern. So I think that's, am I concerned about it? Yes. But specifically, am I more concerned about it now and related to the pandemic? Somewhat, because people are using disinfectants more because they're concerned, but I don't actually think that this is a specific issue related to the pandemic. I think this is a chronic, this is a concern all the time.
Okay, here's another question for you, Stephanie. A number of companies that market microfiber cloths state that they clean extremely well with just water. But I see that you're recommending people that use soap along with microfiber cloths. Is the claim that the cloths can clean effectively without soap accurate?
Yeah, sure. Great question. And I also saw that there was another question asking me to reiterate why I recommended microfiber. The reason I recommend microfiber is that there have been studies that show that microfiber transfers less microorganisms from one surface to another. So if you're cleaning, 3 doorknobs in a row, you're going to have less microorganisms transferred from doorknob 1 to 2 to 3 with a microfiber cloth than with like a terry cloth towel. In terms of the claims that they can disinfect or get rid of 99% of organisms with just water, I think the hard thing about that is that EPA, which is one of the, so in this country, the only people who can register disinfectant products is the EPA. So other groups can evaluate cleaning products, but they can't actually do third-party evaluations of disinfecting products. And EPA doesn't register devices. So it makes it really hard to compare things like just using a microfiber cloth or just using, there are other kinds of devices, steam cleaning devices and those kinds of things, UV lights. Those aren't compared in the same way to chemical disinfectants. And so I can't really answer the question because the information isn't out there.
Okay.
So the safest thing to do would be to continue using soap with it.
Okay. We had a question about tracking the virus in on your shoes. I've heard it can be on dog poop or human feces. If you walk or hike often, what should you do with your shoes? We'll go ahead and say that taking off your shoes and not wearing them in the house is actually the safest thing to do, not only during this pandemic, but because shoes have been found to be a big source of lead dust contamination in the house and pesticide contamination, other things. So it's a good idea to always take them off at the door.
Agreed.
So, yeah. Let's see. How about UV light and buying devices to disinfect objects such as keys or masks?
Yeah, it's a great question. As I said, the issue is that there's really not third-party evaluations of devices in the same way that there is for chemical disinfectants. I wish that there was, because I think that's an area where we really could use some more information. But it's just really hard to comment on those things at this point. You're sort of at the whims of how accurate the manufacturer's information is, because there's really not third-party evaluations of those.
Yeah, and we've had similar questions about steam cleaning, and so it would be the same thing. We wouldn't really recommend that in lieu of some of these other things we've talked about, because there's no way of knowing, how hot does that steam cleaner get, and then also there's a lot of issues with how you use it. Are you going, if you're using the steam cleaner, are you staying in one spot for a long time? Are you going quickly? And so we would not recommend that in lieu of some of the things that we've talked about.
And steam cleaning products also around children have the risk for burns.
Yes. Someone asked about disinfecting your keys and the inside of your car. What do you think, Stephanie?
It's a great question. I guess it depends a little bit on your exposure scenario. That answer might be a little bit different if you are a nurse working on a COVID unit every day versus if you're just someone, going out to go to the grocery store. But I think in general that the risk is going to be pretty low in your car unless you are routinely transporting other people. So if you are continuing to have to work as an Uber driver in order to make ends meet right now and you have the general public coming through your car, then there might be reason to try and disinfect high touch surfaces in your car, door handles, for example, seat belts. The clicky part that you hold on to that's not porous. But I, for example, drove my car yesterday to go get groceries and came home. I was the only one in and out of my car. So the chance that something from someone else got onto a surface to then transfer to a surface in my car is pretty low. And so I think it's a relatively low risk. If you're touching your keys repeatedly after you've touched a bunch of other surfaces, you could consider disinfecting your keys. It's sort of the same principle as a cell phone. Again, it's relatively low risk things that you're the only person touching, but something you could consider. Again, I just would be thoughtful about it in terms of your exposure scenario and think about that really your goal is to to weigh these two things, right? That exposure to disinfectants is not benign. And so you use them when you need to, not to just indiscriminately to apply them to everything.
Okay, we had a question about getting delivery of food. What is the best way to clean and bring it into our home? It is packaged in many layers. So you want to think that it depends on if it's like something that someone just made in a restaurant, or if it's like a meal kit where potentially the ingredients have been in there for days before it got to your house. So one thing that we say is just this, if you want to be safe, you can just get rid of all that packaging, pour the food into your own bowls, and then wash your hands really well. And that would be good enough. You don't need to be spraying all of that packaging with disinfectants. If it's something like a meal kit where most likely it got packaged days ago, I wouldn't even really be worried about the things that are, inside of the meal kit. Potentially could the delivery driver have been sick and sneeze on your cardboard box? Yes, it's very unlikely. But if you would like, you can just get rid of that outer box, just dispose of it.
That's what we're doing in my home is deliveries that come in. We leave the outer cardboard boxes at the front door and only bring interior things in. But then we don't do any further cleaning or disinfecting of things on the inside.
We had a question about what's the dwell time for washing a surface with soapy water. I'll say that, with washing hands, the reason why they recommend 20 seconds, 20 to 30 seconds for washing hands is because our hands are very complicated. There's lots of nooks and crannies. There's the in-between, people forget about the thumbs. And then if you look at your fingernails, there's just so many places for things to hide. So that's why the recommendation is 20 to 30 seconds. If you're, let's say, wiping down a simple, surface, do you need to be wiping each area 20 to 30 seconds? No, it's really that you're kind of, covering the surface with the soapy water. Stephanie?
Yeah, and I think the other thing to think about is that the correct verb to use is scrubbing rather than wiping, right? That you're really scrubbing a surface, not just wiping it. And that if you've scrubbed everywhere, you're going to have achieved what you need to do. Okay.
We had one or two questions about how long does a virus stay active on skin? So your face and hands. Should you be washing your face when you get home?
That's a great question. I hadn't thought about that. It certainly wouldn't hurt to wash your face with water. I think it's relatively low risk. The reason that hands are an issue is because by nature, right, we go out and touch a whole bunch of different surfaces with our hands, even if we're not thinking about it. It's probably less likely, particularly if you're above the age of 2 or 3, that you're rubbing your face on things, but not impossible. I think it's relatively low risk. Could you wash your face if it makes you feel more comfortable? Absolutely, but I think it's pretty low risk.
Yeah. Let's see. We already talked about that. How about with masks, putting masks in the sunlight to disinfect or hot air like a dryer?
I would recommend washing them instead. I don't know of any evidence that says that will get rid of the organisms particularly well.
Yes. Let's see. Someone asked about using vinegar as a disinfectant. I'll just say that vinegar is not a disinfectant. It can be used as part of a cleaner. So cleaning to physically remove the particles, not to deactivate them on the spot. And then a follow-up to that is someone asked, is it safe to use a vinegar solution to clean the surface first, followed by bleach for disinfecting? Because of what Stephanie mentioned of it producing toxic gas when they're mixed together.
I would be really careful about doing that. If the vinegar has long been dried, then it's less of a risk of putting bleach on the surface. But at that point, how long have you left it, and is it still clean and ready to be disinfected? I think the other question that I saw regarding vinegar is vinegar an asthmagen? And it is as well. So you do want to be careful using vinegar around small children. That's why I recommend soap, preferably as a cleaner as opposed to vinegar.
Someone said something about, okay, when you're out and let's say you're going to the grocery store and you pay for groceries, you're reaching inside of your purse or going to the ATM to get cash, what's the risk? I'll say that, you know, actually a lot of stores are now encouraging people to use touchless, so Apple Pay or something similar to that where you don't actually need to be touching the keyboards. As much as you can do that. If you are concerned about, you know, reaching into your things, touching something, reaching back into, that's why I said bringing a like a cotton tote bag instead of a purse that you can't wash would be a good idea. Stephanie, do you have anything to say about that? What items you bring when you go out?
Yeah, I mean, I think as much as you can, being conscious to try and touch your personal items as little as possible. It's really hard because it's not, you know, sort of the usual MO that we've all operated under. But I think, you know, what you want to think about is that as soon as you've held on to a handrail or pushed an elevator button or touched a shopping cart that other people have touched, you've potentially contaminated your hands. And so really minimizing the number of things your hands can touch. So if you can do things like, you know that the credit card you're going to pay with before you go in, you know, put that one in a zipper pocket in your jacket so you don't drop it. But so that you don't have to now dig through your purse with contaminated hands. You can do some of those little things to minimize the number of things that you're touching. Again, once you're talking about a contaminated surface that I touch and then I transfer to something else and then it transfers to something else, you know, you're going to have fewer bacteria, fewer viruses transferred with each of those steps. So it becomes lower and lower risk. But the easiest way to sort of minimize risk is to just minimize the number of things that you're touching with contaminated hands.
Okay, we had a question here about, is the Design for Environment list sufficiently updated for practical guidance in regards to products on the market? Is the mix of perioxyacetic acid with hydrogen peroxide and asthmagen? I often see these two chemicals in combination in disinfectants. Yes, I also saw those very common on the list and products.
Yeah, unfortunately, so individually, each of those active ingredients is thought to be okay, but unfortunately put together, those two actually, there is some evidence that there can be some asthma causation. And so you do want to be careful about products that have both hydrogen peroxide and peroxyacetic acid. Peroxyacetic acid alone is not an asthmagen. I see that's also one of the comments or questions, but in combination with hydrogen peroxide, it is thought to be. So that is something to be careful of.
Okay, we had a couple of other questions about, let's say, donated magazines and books, and how about carpet? I'll say that, you know, as the research shows, this specific the new coronavirus doesn't live for very long on paper goods and soft surfaces like carpet. So I wouldn't, be concerned about disinfecting them. If you really want to be extra careful, you can, with anything, magazines and books, you can, just wipe them off or just leave them for a couple of days, and that would be fine. And
yeah, I'd recommend, if you want to do something, just leaving it rather than trying to wipe them down. You know, disinfectants aren't certified for use on porous surfaces like magazines or books. So you really don't know how good of an effect you're going to get trying to wipe things down, and you're still exposing yourself to the chemical. So I think if you're worried about it, you know, if you have a garage where you can set them for 2 or 3 days, that should be plenty of time. If you don't have a garage, you have a cupboard where you can set them for 2 or 3 days and not have people touching them, that should be fine.
Yeah, and with carpet, you know, it's not really a surface that we would be concerned that you're reaching down, touching the carpet all the time and touching your hands. So I wouldn't be concerned about that. I mean, you can clean your carpet by vacuuming and things that you would normally do for a carpet, but I don't think there should be an extra reason to wash your carpet. Do you recommend washing fruit with soap and water? Is it safe to eat the fruit after it's been washed in soap? Some people say a film from the soap can persist on the fruit. Yeah,
so you can wash fruit in soap and water. You can also just use water. I mean, a big portion of what you're trying to do when you're washing fruits and vegetables is just mechanically remove any material that's on there. And so scrubbing it well with water, particularly under a running tap where you've got some water pressure acting on it as well, that'll also help. But I'm not worried about health effects from using a basic unscented dish soap, for example, to scrub fruits or vegetables. That's not going to cause you problems.
Yeah, I use like a Castile soap, like Dr. Bronner's, that's unscented. Yep. I think it would be different if you're using like a hand soap that's heavily fragranced. And yes, I would not recommend washing something that you're going to eat with something that's heavily fragranced with lots of like colors and things like that in it. So, but we would.
Correct. Or
anyways, yeah.
Yeah, and antibacterial hand soaps, I don't recommend anyways for a number of reasons. They can have other health effects, but particularly for this, I would also not want you using an antibacterial hand soap to try and wash food and then ingest it.
I think that Hannah, we're running out of time. So I will say that some people have asked about links. The slides, the recording are all going to be on our website. If you registered for this webinar, it will be automatically emailed to you tomorrow so you can share with other people.
Karen, can I answer?
Yeah. Oh,
can
sure.
I answer one other group of questions that I saw? I saw a couple of questions about dwell time and disinfectants drying quickly. Either if you're in a warm area and they dry quickly, or if you're using wipes that don't leave the surface wet for long enough. If that happens, it's not effectively disinfecting. So it means that you either need to if you're using a liquid product, you need to re-wet the surface to get it wet. So the person that asked about a warm climate and it dries quickly, is that okay? No, you should actually be re-wetting the surface. And if your wipes are not wet enough to maintain a dwell time that is long enough, you again need to either be re-wiping or using a different product to keep the surface wet long enough. I'll be honest that I personally don't use wipe products for that reason, because I find that even the ones that are sort of, fresh out of the package, it's pretty common that they can't leave the surface wet enough.
Yeah, and for some of the DIY cleaners, like if you were to use the hydrogen peroxide or alcohol, there really is no, like if you're using like a fine mist spray, there's really no reason to go back and wipe it off. Just let it dry. And that frankly is easier than going back over. Let's see, was there anything else? Did you see any other questions?
So someone asked about,
oh, sorry, go ahead.
No, you're fine. About in the fire department having to disinfect their masks. So this is a little bit of a different question than for the general public. But I think two things. One, there's not a lot of data about that. So you should know that you're sort of operating in a sphere where there's not a whole lot of data. I think the safest things would be to try and use a disinfectant that doesn't have respiratory effects. So something like peroxide that's not known to have respiratory effects. But that regardless, whatever disinfectant you're using, you should make sure it's been long since dried before you're trying to wear that mask and breathe through it again. Being sure that you're not disinfecting and then immediately putting on. But, if you're cleaning it at the end of your shift, for example, and then leaving it for 12 or 18 hours, that would be safer than doing it and wearing it immediately afterwards.
Yeah, and they are doing research, looking mostly in healthcare settings on how to, properly disinfect N95 and other sort of personal protective equipment. So there, I think we'll know more as more research is coming out, because that's like a high priority issue that people are looking into.
Agreed.
Yeah.
And someone asked whether they can use our infographics. Please do. We really want this to get out to folks. We have a PDF version of it on our website. If you'd like one that's optimized for Facebook or Twitter or Instagram, email our coordinator the emails on the website, and we can get you those optimized versions. You can also retweet from our account.
Someone asked, if I use a basic soap, like a greener or more non-toxic product, do I have to, is it less safe in killing the virus? The answer is no. When you're talking about cleaning, any hand soap, a basic, even like a Castile soap with, no added extra things, fancy, no fancy thing necessary. Even bar soap can be very good.
And I think the thing to remember is that, following the instructions carefully matters, right? So, using just a plain dish soap or Castile soap with water and scrubbing well is going to remove more organisms, kill more organisms than taking a bleach or quaternary ammonia containing wipe and quickly wiping across the surface. So you'll actually have better effect from using some of these basic products if you're using them correctly.
Okay, Hannah, we'll look through the other questions and we can email people if there are some questions that we didn't get time for.
Absolutely. We'll go ahead and take a look at the Q&A report afterwards and see if we can get back to folks who need more answers. Thank you so much, Dr. Holm and Dr. Wang, Karen, and Stephanie for your presentations and for answering all these great questions and all the information.
Absolutely.
You provided. Yeah.
Thank you to everyone for joining.
Yeah, thank you. So we're approaching the end of today's webinar. A video recording will be available on CHE's website soon, and tomorrow you'll receive an email containing a link to the video, which also contains the slides. The next CHE Strategies Partnership webinar is tomorrow, May 20th. It's our 4th webinar in the series Cancer and the Environment, Science and Opportunities for Prevention, and is titled Chemical Mixtures and Cancer. To learn more and RSVP, please visit our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these CHE partnership webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers, Dr. Stephanie Holm and Dr. Karen Wang. Thank you for presenting today, and Karen and Stephanie both for helping moderate and handle the Q&A. Please stay well, stay healthy, and thanks for joining us.
Thank you, Hannah. Just a quick note, if anyone's still listening, we are hoping to do one specifically about childcare environments sometime in June or July. So stay tuned. Thank you. Thanks so much, Stephanie. That was great.
Thank you, guys.
Yeah, thank you for working with us. We'll work with you soon. Bye-bye.
Bye.